Good morning, everyone. I'm Alankrita, and today we have with us Yeja. She is a psychologist at PsychSpace, and we are going to have a small or a brief discussion on geriatric mental health. So let's start with the session. Uh, so, Yeja, uh, uh, we are going to have a small discussion. So I'll just put forward the first question. So the first question is, what are the common mental health issues faced by older adults?
Alankrita, I think the topic that we're going to talk today is like very crucial and it's much neglected. So I just want to address this thing before we get ahead with the webinar today. That the word geriatric mental health is something which is like very relevant and is very important in our society, but gets highly neglected, right? And the word geriatric itself, if there's someone who doesn't know what does the word geriatric mean, it means it's a field of older people, aging people, our senior citizen. Okay, so that particular group is known as geriatric. And you know their mental health, their concern, how do they deal with their mental health, their struggle, is all that we're going to talk about today. So as Alankrita has asked me, like, what are the common mental health issues that are faced by our older adults. So one thing that is inevitable in every human being is that everyone has struggle in their own life. Be it a kid, be it adult, be it a senior citizen, everyone has their own set of struggle, their challenges, stress, anxiety, and all of these things. So mental health challenges, when we talk about geriatric, is not a population which is blessed with no sort of mental health issue, but it is a population where, just like us, they also go through a lot of mental health concerns. So if we talk about some common mental health issues that we see in our day-to-day setting, one of them is their mood. They're highly on the depressed side of the mood spectrum, and they face a lot of disturbance in regulating their mood and they have problems with they have problems like anxiety. Then when it comes to neurodegenerative disorders, there is dementia, there is Alzheimer's, there are also sleeping disorders, there is also late life schizophrenia if we go into the spectrum of psychosis. So and along with that, they struggle with loneliness, grief, adjustment issues, because with our senior citizens, there comes a time of retirement. There comes a time of grief where they lose their loved ones. They also go through a syndrome which is called as empty nest syndrome, where throughout the life the kids has always been with them, and then at a certain point of time, because of the kids responsibility with their own career and their family, they have to move ahead from that particular house, leaving their parents behind. So there are so many things which are undiscovered and not talked about much. And then there is when we talk about retirement, with retirement there comes the loss of independence. How they used to have a fixed schedule routine. In the morning they used to wake up, they used to go to the work, then they would go to meet their friends, and they come to family and have the dinner, spend time with the family. But then all of a sudden, there's no work anymore. Even if the person wants to work physically, but due to the age they cannot work anymore. And with age comes obviously grief and death. So that is another concern. So these all are different aspects of mental health issues which are faced by our older adults, our geriatric population. Alankita.
Sorry. So, yes, I definitely agree. As like people grow older, they like the older side of the society, they have this, they have always been independent. They have been working their entire life, and suddenly when they stop working, when they stop going out, they feel like they are trapped in their own house. They have this they also have to go through the loss of their loved ones, be it any family members, friends, or someone they knew. And it is very difficult, as most of the older generation, they find it difficult to express their emotions. And we the younger ones, we also like we don't pay attention to what they are going through, which is really important for it is important for us to actually talk to our grandparents, or talk to the older generation. And basically when they feel trapped, they end up having thoughts, and as I mentioned, they are less expressive. Entire schedule, or entire schedule is like changed. Suddenly it changes, like from there stems depression, also anxiety about what am I going to do now, what will happen now. And then they also have this anxiety about what if something happens to me, what will happen if something happens to me, right? So yes, I agree with everything you said. And this is what I had to add. So going forward with the next question, what role does social engagement play in geriatric mental health?
Right. So, when we talk about social engagement, like previously mentioned, like we have been talking about like the loss, the grief, the loneliness, all of these things that comes with age. Social engagement is something which is like very crucial for the mental well-being of older adults. It reduces the feeling of loneliness for so, and it reduces the feeling of isolation, when you don't have your kids around you, when you don't have your wife or your husband around you, you don't have any familiar faces around you, but you have caretakers, but you have people who just are there for your health needs and everything. In those times, I think, when we stimulate a little bit of social engagement in their life, it's gonna affect, you know it's gonna give them a lot of different boost in their overall mental well-being. Because when we talk with people, when we talk with someone, so as we all are human beings, and when we talk about human beings, we are all social in nature, right? No human being was created in a way that they can be alone for the rest of their life in a room or in a place with no one around them. We are social being. That's what our brain requires us to interact, us to share, to have, even though it's a virtual interaction, but our brain take it as an interaction where it releases a lot of hormones in our body. Not hormones, a lot of good yeah, a lot of hormones in our body, where it makes us feel like yes, and a lot of neurotransmitters in our body, where it gives us the feeling of happiness, when it gives us the feeling of content, when it gives us the feeling of less distress, a feeling of a sense of belongingness, like yes, I have people in my life, there are people who care about me, and there are people with whom I can share with what I'm talking about. So social engagement is very necessary for them, because they are very prone to loneliness and isolation and grief. And when we talk about loneliness, isolation and grief, social engagement, making them talk, being included with people, being included in a group, being included with people with like mindedness, is going to definitely boost their overall mental well being. And it definitely helps, for for them, for the population. I think that's all I have for my end, Ankita.
Yes, Girja. Likewise, I would also like to add no one can be alone. So it's like there is a particular, particular song I remember, song or carol. I don't exactly know the exact name, but we were taught this in school. Like no man can live as an island. So like it is very very important for for the now that we are talking about the older adults. So it is very important for them to be social, because as they grow old they have this feeling, when they have this feeling of not being heard and not being understood, they have like they feel very sad. Like according to them they are like, I'm very sad, you did not understand what I was trying to tell you. I want to do this, I want to do that. And some of the older adults, they don't even realize that they it is not some of the work that they used to do earlier, it is difficult for them to do it now. So that is also something which makes them very anxious. Why am I not being able to do this? And that's the reason why when they engage in social engagement, socially, when they talk with people, when they especially when they meet the same people of their same age, they realize that this is something they should embrace. And this is okay, because according to, like, it is also something new for them. So it's like they will start embracing that. And when they talk with people, like with their loved ones, they'll feel like they are being heard, they are being understood. And in that way, that way they'll have lesser feelings of loneliness, and they'll not be isolated, and they'll feel welcomed by everyone. So that's all I have to add. Going forward with the next question, what mental health resources are available for the elderly?
When we talk about mental health resources for elderly, it is, yes, the resources are available, but it's like for 100 older other adults, there is like one psychologist or two psychologists or a group of, or let's just say five individual psychologists. Right. So the demand is a lot, and the service that and the service and the people who should be there in this field are very less. It's a very demanding field. But when we talk about resources, there are few resources that India right now are currently trying to bring, and there are some resources which is already working. First is counseling and therapy for the older generation, for the, sorry, not generation, for the older adults. And when we talk about older adults, when we talk about counseling and therapy, it involves individual, it involves group, and it also involves family, family therapy together. There can be sessions with one-on-one with the individual and the therapist or the psychologist. There can be also sessions where they are in groups, just like Alankita said, like similar like-minded people of the same age group, or the same, going through the same problems in a day-to-day life. So in that sense, they also have a group setting with a psychologist or two psychologists, where they can talk about it, about their day-to-day struggles and their challenges in their daily life. And apart from that, family therapy plays a very important role when it comes to geriatric mental health, because a lot of their struggle and challenges somewhere stem from their family itself, right? The need to be associated and to be connected with the kids, with the wife, with other people, with friends. So family therapy also plays a very relevant role in this whole in this whole process of geriatric mental health. Apart from there are some there are some crisis helpline, there are some helpline for crisis interventions and services as well. And apart from that, in Bangalore and in some cities in India, there are also good number of support group, you know. It wouldn't be telling you, it wouldn't be advertised as support group per se, but it can be promoted as a wellness group, you know, of like-minded people of a certain age, where they can just go in the morning, spend the morning together, because physical activity plays a very important role for them. So maybe a little bit of yoga, a little bit of physical, you know, movement, and then interaction, talking, you know, how was the previous day, what were the struggle they faced the other day, and all of these things. So these are the, you know, kind of resources which is available in the society. And yeah, if anyone actually feels the need, they can actually reach out to places, they can search where they are, you know, where these sort of resources are given. And they, and according to the need of the senior, we can actually, you know, put them in the right place. Apart from this, there are certain symptoms which are quite severe when we talk about depression, when we talk about Alzheimer's, when we talk about dementia, when we talk about other, you know, other psychological or psychiatric illnesses. In those cases, there are geriatric MDs, like psychiatrists, where they can actually provide medicine for the geriatric population, which helps them with medication to ease their symptoms and whatever they're going through, their challenges, right? And just like that, there are clinical psychologists well trained in this particular field. You just need to see the specialization the psychologist is in. Is it geriatric? If yes, then they would be a great benefit to their day-to-day life. So yeah, I think that's all I have to add from my end, Alankita.
Thank you so much, Asia. So yes, it is true that a very small amount of mental health professional are available for the elderly or the older adults, and it is some geriatric mental health is something we need to focus on really, it is very crucial because the elderlies are mostly, they are we feel like the elderly have experienced everything in their life, so since they have experienced everything in their life, it will be easier for them to go through, after retirement, or after they are done with everything that needs to be done. But that is not true. The entire 60 to 65 years of their life, they have had this particular lifestyle, and there is a sudden change in their lifestyle, so it is very difficult for them to adjust. So that's the reason why these resources, like Hija mentioned, counseling, therapy, it may be group, it may be family, or it may be individual. And then there are also helplines in crisis intervention services, and it is something a lot of people are not aware about. That is the reason why we have put forward this discussion with everyone today. So, going to our last question of the session today. So, what does the current field of geriatric counselors look like?
Right. Like it's a ongoing answer to what I have added in the previous question. So, Alankana, I feel like it's not I feel, but it is very evident that, like I said, for 100, or let's just say for 150 senior citizens, there is just three psychologists or a handful of five psychologists, and they have to see these number of cases, right? So is there, if I ask the question, if there is scope in geriatric mental health, 100% there is. But is there is a demand for geriatric mental health? Yes, there is. But is there are available trained mental health professionals in this area? I'm afraid it is very less. I won't say there is none, but yes, a lot of places are developing these courses. A lot of places are enriching these topics with available resources and trainings. But still, the need is very high, the demand is very high. And in other countries such as US, UK, and other different countries in the world, they have already been working on this population from quite a long time. And when we talk about the field of geriatric counseling, it is expanding due to the rising elderly population, to be honest. And the increased awareness about mental health is actually the reason why geriatric mental health are is now on on taking a march towards or between the conversation. Like, people are now talking about it. And like Alakrita has said before, like, we always have this stereotypical notion in our mind that just because they are old and they are elderly to us, they have they have learned everything in their life. They know, they have all the wisdoms in their life, and they have actually almost sab kar liya life mein. That's what we think when we talk about them, right? But the fact that they are still a human and they have needs, they also have some desires, they also are heard, they are also crave for interaction and humanly things and needs. This is a reason why this field is now most it's not now neglected like it was used to before. And I'm really happy with that. But when we talk now, I think Anamita also asked me about geriatric counselors, right? So geriatric counselors basically helps seniors to cope with emotional and cognitive and social challenges, including the mental health issues that I mentioned before. And in countries like US, professional certifications exist, and for specialization in training. Now, luckily, we in India also we have a lot of such training as well, right? But it is still not at the front foot. In site space, actually, we have recently launched one of the first ever geriatric mental health courses for postgraduate students. It is for students who have completed their masters, or who are soon going to complete their masters. And in this particular course, we are in collaboration work with an amazing set of members from team Neri Game, where they are specialized for geriatric mental health care and geriatric physical care, not just mental health, but overall geriatric population. So Nerigam and Psychspace has come together and have developed a very enriching and a very resourceful 3 months of course for post graduate students in the field of mental health, so psychiatric social workers, and people who are already in this field of mental health. And that course is also going to give definitely a boost to individual who enrolls. And if you are someone, if you're looking at something similar, and if your interest also lies, I would really urge you to enroll yourself for that certification course, because it will gives you not just practical but hands-on training. Because Nerigam have not OPD setting but IPD setting as well. So you will have interaction, you'll have live classes with the patients who are already in the indoor who are already admitted in the in the organization. And then with the theoretical knowledge, you can apply it directly during this course. And yeah, I think this is a very good opportunity for, especially for kids who are in India and who do not have much resources and don't know how to go about geriatric mental health. So you can definitely give it a try, and you can, for any more information, you can definitely reach out to us, right? So yeah, Alamrita, I think that's all I have from my end. If you have anything else to add, please do add.
Uh, so coming to the, back to geriatric counselors, as Ija mentioned, it is true that a very small amount of, psychologists are there to, help geriatric patients. It is mostly because, most of the people are not aware about, geriatric counseling. They know there is geriatric counseling, but they are not aware what geriatric counseling actually is, or they don't know what geriatric counseling actually is. So like Asia mentioned, there are, certificate courses where they teach you, how to uh, how to what geriatric counseling is, and what is included in geriatric counseling. So just like Asia mentioned, psych space is, psych space with association association with Nerigine. They have created a course. It is like the first course, not in Assam, not in Northeast, but the entire India, to, where there will be a, it is a geriatric mental health course for postgraduate students, for students who have passed their masters, as well as who are going to, like it is like, in a few months they are going to pass their masters. So you all can definitely, um, you know uh, enroll yourself in this course. And also, if you all need more information, we have our Insta page on Psychspace. You all can go there. You all can DM us. You can DM us and ask us about the course. Not only about the course, even if, like, you have someone, you are going through a tough time, or you want, a professional help. We are just a DM away. So we have come to the end of this brief discussion on geriatric mental health. I I thank my viewers, our viewers, and I thank Yeja, who have, who happily decided to be a part of this, discussion, and help us learn so much. So that's all for today. I hope you all have a good day, a very good afternoon to you. Thank you.
Thank you so